Good afternoon, everyone. It's my pleasure to warmly welcome you all to the launch of the National Report for Writing Themselves In For. My name is Jackson Fairchild, and I'm the Head of Policy and Programs at Rainbow Health Victoria. We're part of the Australian Research Centre in Sex, Health and Society at La Trobe. Before we begin, I'd like to take this moment to acknowledge the traditional owners of the land on which we all live and work and recognise their continuing connection to land, waters and culture. I pay my respects to elders past and present and extend that respect to all Aboriginal people here with us today and who have participated in and supported this study. It always was and always will be Aboriginal land. The video that was playing earlier, and we must apologise for the small technical errors we had while we were getting all of that started, was released in September 2019 as part of a social media campaign calling for participants in the latest iteration of Writing Themselves In, a population health study of LGBTIQA+ young people. The response to this campaign was nothing short of astounding. We asked them to tell us their story, and 6,418 young people did exactly that, making it by far the largest study of its kind in Australia. Today, we now have over 700 people registered for the launch of the study, which makes this the largest audience we've ever had at the launch of a study at ARCSHS. This enthusiastic response is a welcome reminder that despite the challenges our young people still face, we have never been in a better position to change that together. We are all here today because of a shared vision of a bright future. We are each, in our own way, part of a movement working to build a world where all LGBTIQA+ young people are celebrated and free to be themselves in an equal and just society. Some of the information being presented here today is hugely confronting. It is also a profound call to action. In preparing for today's launch, we as a team have been reflecting on the challenges of appropriately presenting this information. We've asked ourselves, how do we balance the sense of urgency and gravity this research demands with hope and pride and forward momentum? While we mustn't shy away from the reality of how things are, we must continue to work to transform outrage into action and division into coalition. Once again, COVID-19 means that we are meeting over Zoom rather than in person. And while we'll all miss the chance to talk together informally over a bite to eat, I would like to encourage you to take notes as on your reflections over the event. Think of who else might be interested in talking about this as you do, and seek out them afterwards to talk it through and think about what this research means for you, your community, and the programs and policies that you are guiding in your work. Today, we'll hear from a range of terrific presenters, as well as hearing about the findings of the National Report. We'll reflect on the history of Writing Themselves In, the incredible impact it has made, and what this latest research means for the future of policy supporting the wellbeing of LGBTQA+ young people. To formally open today's proceedings and to officially launch Writing Themselves In For report, I'd like to welcome the study's lead investigator, Associate Professor Adam Bourne. Adam is the Deputy Director of the Australian Research Centre in Sex, Health and Society and oversees the LGBTIQ Health Research Program within the Centre. Over to you, Adam.
Thank you so much, Jackson, for those opening remarks. I would like to add my own acknowledgements of the traditional custodians of the land in which we meet in our many different parts of the country. For me, here in Melbourne, those are the Wurundjeri people of the Kulin Nation, and I pay my respects to their elders past, present, and emerging. It's such a pleasure to be able to sit before you today to launch the National Report for Writing Themselves In For. This project and the report has been a long time in the making. And I hope today we can accomplish three things. Firstly, this is an opportunity to thank the great many people who made this project possible. Secondly, I want us to be able to celebrate everything that is wonderful and creative and brilliant about the lives of LGBTIQ+ people in Australia, in all their diversity. And thirdly, I hope we can empower you. We've tried our very best to craft a report that is crammed full of data and new knowledge about the health and well-being of LGBTQA+ young people. And our only hope is that these data can be used to effect meaningful change. So let me start with those thank yous. Writing Themselves In exists because of two remarkable women who recognize the need to shine a light on the lives of LGBTQA+ young people and to try to highlight the immense challenges that they faced. Lynn Hillier and Anne Mitchell have been a force for good in the LGBT community for more than 20 years. And as they passed the mantle on to us to continue this project, they offered us their time, their wisdom, and their considerable expertise. I am incredibly grateful for all the support that they've given us, they've given me and the rest of the team during this project. They and the teams that supported them on previous iterations of Writing Themselves In have laid the groundwork for this valuable program of research that we continue today. Writing Themselves In 4 was made possible by the generous support from the Victorian Department for Premier and Cabinet, the New South Wales Department of Health, the Australian Capital Territory Office for LGBTIQ Affairs, and Shine SA with the support of the Office of the Chief Psychiatrist in South Australia. We're immensely grateful for their contributions, for helping us continue the story of Writing Themselves In. And over the coming weeks and months, we'll be publishing summary reports that break the data down for each of these jurisdictions. And in fact, if you look on our website right now, you can see those reports for New South Wales and South Australia. Writing Themselves In was conducted by a fabulous team of researchers here at the Australian Research Centre in Sex, Health and Society, a dedicated, creative and expert team. Anthony, Adam, Jamie, Marina, Matt and Jen all made this happen. And if this were a physical event, I'd ask them to stand up right now and take a bow. Especially Adam Hill, who as the project manager really did go above and beyond all our expectations. Writing Themselves In 4 was a success because of our remarkable community advisory board. They played a vital role in helping us secure funding for the study. They helped shape the objectives. They provide substantial input into the survey design. They promoted it within their networks. They advised on how we could best use and report the data that you have before you. So to Sarah, Terence, Peter, Starlady, Josh, Tracy, Micah, Adrian, and Bonnie, the entire research team offer our very heartfelt thanks. Writing Themselves In 4 was made real by our truly fabulous youth advisory groups. Members who feel comfortable with us sharing their names include Rory, Rose, Max, Jamil, Lachlan, Sunny, Claire, and Freya. These two youth advisory groups were central in ensuring the survey spoke to the issues of most importance. They helped ensure we asked questions in the most appropriate way, and they helped ensure we were speaking to LGBTQA+ young people in a way that was engaging and respectful. So they would tell us their story. Thank you once again to all the members of these two groups. And Writing Themselves In 4 was also helped by a much larger range of other people. Those who lobbied for us to get funding, and I particularly want to thank Roe Allen for their support here in Victoria. Those who advised on question design, helped with analysis, or helped get the word out to thousands of LGBTIQA+ young people to encourage them to participate. The report that you have in front of you today was only made possible by this massive undertaking and by the commitment of all of these different groups and people that I've mentioned. Their combined efforts helped us to achieve the largest ever sample of LGBTIQA+ young people in Australia, and one of the largest in the world. In total, 6,418 LGBTQA+ young people completed the survey from all over the country. And with a sample size of this magnitude, it's possible to break down findings by jurisdiction to help shape local policies and programs as well. But more importantly than it being large, it's also really diverse. And for the first time, we have a sample big enough to break down the findings, not only by gender and sexuality, but also according to whether or not people had a disability, whether they were from a range of different ethnically diverse and culturally diverse backgrounds, or whether they live in rural and remote locations as opposed to the city. And as you'll see in those dedicated chapters of the report, all those characteristics and intersections really matter. We're a strong community with a rich shared history, but we're as diverse as any other section of the population in Australia. And we can't lose sight of that when we're planning programs or designing services. We were absolutely thrilled to see such a high engagement from among Aboriginal and Torres Strait Islander LGBTIQ young people, and 256 in total took part. To the best of our knowledge, this makes it the largest such sample ever recorded, and there is so much we can learn from these young people. Their data are included in the report, of course, but obviously there's a need to further disaggregate these data so we can focus in a little more on their experiences. And to that end, we've been establishing a partnership of Aboriginal organizations and researchers to come together to work with these data, to help us interpret them and to make sense of the experiences that are reflected. So watch this space. We're really hoping we can come back to you with further details and outputs in the near future. But we have to own the fact that we haven't been perfect in every respect. And despite putting in a huge amount of effort and working really hard and working very closely with Intersex Peer Support Australia, we didn't see a sufficiently large number of young people with an intersex variation participate. We tried all manner of approaches. We crafted specific aims within the survey to speak to their needs. We had a module of questions specifically trying to examine their unique experiences. We have bespoke recruitment strategies, but in the end, only 20 young people with an intersex variation participated. All of those 20 who did take part are still included within the data set that we're reporting on here today, given that all of them, all 20, also identified as either lesbian, gay, bisexual, or trans or gender diverse. But it wouldn't be appropriate for us to refer to this report as one reflecting the experiences of young people with an intersex variation. And so for that reason, we refer to it in terms of LGBTQA+. I think to do otherwise would wrongly give the impression that the findings speak to the needs and experiences of young people with an intersex variation when we really can't be confident that's the case, given there's such a small number. There's obviously an awful lot of work to be done to better understand the lives and well-being of young people with an intersex variation. In the report, you'll see some really detailed recommendations that we and Intersex Peer Support Australia feel need to be taken into account when planning future work. So what can we celebrate? Beyond a large and diverse sample of young people who came forward, what else can we celebrate? Well, the answer, of course, is all manner of things. But what I specifically wanted to do here was draw your attention to findings that give us hope and inspiration. More young people than ever before have said they'd come out to their friends about their sexuality or gender identity. And most crucially, most important of all, they felt supported when they did so. Now, it wasn't all that long ago that many LGBTQA+ young people routinely found themselves isolated or excluded. And it's a testament, I guess, to social change that such a high proportion now feel able to talk openly about their sexuality or gender identity with trusted individuals in their lives. There's also signs that more young people are talking about their gender identity or sexuality with family members as well, although that isn't always true for those from different ethnically diverse backgrounds. I'm not suggesting these data are perfect, but I am saying they perhaps represent a step forwards. We didn't ask many open-ended questions in the survey, but one we did ask right towards the end was, what makes you feel good about yourself? And these are some of the most remarkable data, I think, in the whole report. And on those occasions where, like I or the rest of the team, were feeling weighed down while sifting through some very challenging findings, the answers young people gave to this question were nothing short of inspiring. I encourage everyone to have a read, particularly of the quotes presented in chapter 14 of the national report. The findings speak to how young people value meaningful connection to others, how being affirmed by others in their gender or sexuality can be the most rewarding experience of all, and how they find ways to express their individuality that makes them feel confident and empowered. They talked about the creative outlets they found, the relationships that matter to them, and the positive changes they tried to bring about for their community. If we're to try and improve health and well-being for LGBTQA+ young people, then these are the strengths and values that we can be drawing upon. But while those findings give us much hope and much to reflect on, it's also clear from other findings in the report just how much more work still needs to be done to ensure that LGBTQA+ young people can lead happy and healthy lives, safe within their communities and affirmed in who they are. There were over 220 questions in this survey and 6,418 participants. That means there's about 1.4 million points of data, and therefore there's a story you could tell about every section of the LGBTQA+ community, one that's specific to their particular issues and concerns. Now, obviously, I can't tell all of those stories here today, but I hope at least this will start a discussion that will occur with lots of other people in lots of different meeting rooms or Zoom rooms all across the country in the coming weeks and months. There are certainly some very big challenges ahead of us. Mental health, unfortunately, within the community is perhaps the most significant concern. More than 81% of participants displayed signs of high or very high psychological distress. This was even higher among young people living with a disability or those living in rural areas. 62% of participants had self-harmed at some point in their lives, 41% within the previous 12 months. And 25.6% of participants, that's 25.6% of participants had attempted suicide at some point in their lives, 10.1% within the previous 12 months. This is a rate at least 3 times higher than what we observe within studies of young people in the general population. These kinds of statistics are appalling, and the situation just cannot be allowed to continue. Plans are urgently needed to address mental health within the community and to ensure LGBTQA+ young people can feel safe and can feel affirmed whenever they access mental health services. But as you reflect upon those mental health statistics, it's really important or essential that you hold in your mind the kind of environment that many LGBTQA+ young people still inhabit. 40.8% of participants experienced verbal harassment specifically related to their sexuality or gender identity in the last 12 months. 22.8% experienced sexual harassment and assault, and 9.7% physical harassment or assault in the last 12 months. And all of these figures were much higher for people who were trans or gender diverse. This isn't an historic experience of homophobia or transphobia that's been banished to our past. These experiences of stigma and violence have been real, and they have been very recent. They tell us just how far we have to go in tackling homophobia, biphobia, transphobia, and any other hostility directed towards LGBTQA+ young people. For the first time in writing themselves in, we've been able to collect much more nuanced data about this experience as well. The report outlines not only how commonplace the experience was, but also where it happened and who was the perpetrator. The findings here tell us a story of harassment and assault happening in the home, in schools, on the sports field, in public, and on the street. And particularly, and the challenge is particularly evident within educational settings, at schools, TAFEs, and universities. These have been the sites of lots of work over the last decade, and also the sites of lots of debate as well. But the data from writing themselves in for tells us there's still a great deal of work ahead of us. 60.2% of those at secondary school told us they'd felt unsafe or uncomfortable in the past 12 months because of their sexuality or gender identity. And although the proportion was a little lower, still about 1 in 3 of those at TAFE or at university reported a similar experience. And nearly 2/3 reported frequently hearing negative remarks about sexuality in their school in the past 12 months. And over 1/3 reported missing days of school. Such was their concern about their safety. These experiences were again even more common among those living in rural or remote locations. There's a wide range of other data in the report about education-based experiences, about how they felt connected to their school, about LGBTIQ inclusion in their curriculum, awareness of anti-bullying policies, and a whole range of other data besides. But shifting attention slightly, Writing Themselves in 4 also asked several questions relating to housing and homelessness. We used a broad definition for this, including within it experiences of having to leave home because you were asked or made to, couch surfing because you had nowhere else to stay, as well as simply being homeless. 23.1% of participants had one or more of these experiences at some point in their lives, and particularly concerning was the 11.5% of people who'd had that experience in the last 12 months. When we asked those reporting this experience whether they felt it was in any way connected to their gender identity or sexuality, more than 1/4 said that yes, they thought it was, with many others reporting a connection to mental health challenges they were experiencing. We know the many consequences of insecure housing. Young people in this situation are much more likely to fall out of education, to experience poor health outcomes, and to come into contact with juvenile justice systems. It's crucial, therefore, that we tackle the drivers of homelessness and we provide adequate support to those who find themselves in challenging situations. And finally, while there's diversity in outcomes and experiences related for all of the different intersections within our community, I particularly want to highlight some of the unique challenges impacting trans and gender diverse young people, to whom we asked some further specific questions. 86.6% said they'd been misgendered by others in the past 12 months, including 34.7% said this experience of being misgendered happened on a daily basis. 59.5% felt uncomfortable or unsafe accessing public toilets, including 10% of trans men who'd been harassed or assaulted for using a public toilet at some point in the past 12 months. And 54.2% had their gender disclosed without their consent, challenging their ability to affirm their identity and feel safe in their surroundings. These findings and the many others described in this report give us much to be concerned about. And as Marina, my colleague at ARCSHS, will outline in just a moment, there's a great deal of work to do in ensuring that LGBTQA+ young people feel safe and included and are treated with the dignity that they and everyone else deserves. The report doesn't answer every question that we might have, and sometimes I think the findings generate more questions than answers. But I and the rest of the team hope you find it useful in informing service design and planning, policy, advocacy, funding submissions, or any kind of intervention aimed at improving the lives of LGBTQA+ young people in Australia. Let us know how you use the data, what you take away from it, and how they inform your work. We'd really love to receive that kind of feedback. Thanks for your time, and thanks once more to all those people and organizations who made it possible. And without question, thanks to the many thousands of LGBTQA+ young people who told us their story. Thank you.
And thank you so much, Adam, for all of you here today. Adam and the research team have worked tirelessly over the last 3 years to complete this study. And on behalf of the community, I'd like to thank the team for their incredible work, for bringing this report to fruition, particularly during a difficult 2020 for all of us. In many ways, this is a checkpoint, not a finishing line. And as Adam said, there's a lot of work to do ahead of us, but this information will be a very powerful tool in achieving the positive change we need. Our next speaker is Marina Carman, the Director of Rainbow Health Victoria. Rainbow Health is a program that supports LGBTIQ health and wellbeing through research and knowledge translation, training resources, policy advice, and service accreditation through the Rainbow Tech. And we are located within ARCSHS. Marina will be reflecting on the history of writing themselves in and the tremendous impact it has had, as well as exploring the implications and recommendations for future policy and programs. Over to you, Marina.
Thanks very much, Jackson. I'd like to also start by acknowledging the traditional owners of the many lands that we're meeting on today and pay my respects to elders past and present. Always was, always will be Aboriginal land. Well, Rainbow Health Victoria is very, very pleased to be here yet again today, launching Writing Themselves In. Rainbow Health Victoria and our Rainbow Network program have played such an important role in this study, and I'd really like to acknowledge here Jamie Jones, the coordinator of Rainbow Network, who I'm standing in for today, for her contribution both to the process and to the outcome. So our role has been in helping shape the questions, engaging with young people and community organisations, publicising the survey, grappling with the data, as well as drawing out all the important recommendations for change that flow from these results. So it's the culmination of a huge amount of work, and we're really proud to be part of it. So to put the current results into context, I always find it useful to take a bit of a look backwards. So the very first Writing Themselves In was published in 1998. It documented the experiences of same-gender attracted young people at home, at school, and in the community across Australia, and was a world first of its kind. Then we had the second iteration, Writing Themselves In Again in 2005, followed by Writing Themselves In 3 in 2010. So these later studies began to include the experiences of trans and gender diverse young people, and this was strengthened in 2014 with a specific survey from Blues to Rainbows. And this brings us to Writing Themselves In 4, which is the largest, most detailed and inclusive survey of LGBTQA plus Australian young people ever conducted. So the data from these studies have been groundbreaking. In many cases, young people were being asked about their experiences and needs for the first time, and others were hearing for the first time about how young people were faring in increasing detail and with increasing impact. Particularly in the last 10 years, the findings have supported important changes to support the health and wellbeing of LGBTIQA plus young people. This has included change at an individual school level, curriculum changes in areas like sexuality and relationships education, as well as some of the largest investments in LGBTIQ health and wellbeing in Australia to date. So there have been many, many policies, programs and initiatives around the country informed by this research. Here in Victoria, the survey results about experiences at school were a key impetus for the Safe Schools program, a landmark anti-bullying program that began in 2010 and would become a national initiative. This program has changed so many lives, and Rainbow Health Victoria is proud to have been part of it. Also, the Healthy Equal Youth program, now the HEY Partnership, originated in Victoria around about the same time and recently celebrated its 10-year anniversary. So HEY is delivered by the Youth Affairs Council Victoria with a sustained investment from the Victorian State Government, and it brings together a network of organisations specialising in support and services for young people. So Rainbow Health Victoria and Rainbow Network are also very proud to have been part of this world-leading program for over a decade. So moving forward now, it's clear that real and lasting change takes time and is rarely easy. In the 10 years since the last survey, there's been underlying improvement in social attitudes. So though this is more so for sexuality and to a lesser extent for gender diversity and for people with an intersex variation. So this progress is reflected in the results that Adam talked about that show that more young people feel comfortable with themselves and are able to disclose and feel respected and supported when they did so. There have also been significant advances in legislation for marriage equality and birth certificate reform, adoption rights, and current moves to ban conversion practices. And there have been other important changes around non-pathologising models of healthcare, greater representation in the media, and so on. So this transformation has not just happened. It's been driven by research and by advocacy and by the support of services, government and the community. But we need to maintain momentum for change that allows more and more LGBTIQA young people to live happy and healthy lives. So the data presented today and in this survey is also, as Adam said, extremely confronting. Discrimination, harassment and abuse continue to feature in the lives of many young people, leading to profound harm and poorer health outcomes. And addressing this requires meaningful, broad and sustained action to address the drivers of these experiences and outcomes and to prevent harm before it occurs. So we need to build on existing efforts and work towards greater coordination and a strategic vision to really drive home the sort of generational change that is required. And in doing this, we need to remember that the greatest resource we have are young people themselves. They know what's good and what's wrong in their lives, and we need to listen to this in designing and shaping our response to the sorts of findings that we have presented today. So in the report, we've made a wide-ranging set of recommendations in key areas which we hope will guide future effort and investment to improve people's lives. So this includes a focus on primary prevention. So that is addressing the underlying drivers of poor outcomes, including those that are made worse for particular groups with intersecting experiences of discrimination and disadvantage. It includes an urgent focus on developing affirmative, effective and responsive mental health care that meets the needs of young people with a mixture of LGBTIQ, community controlled and specialised services and inclusive mainstream services. It includes the need to develop inclusive services in other critical areas supporting young people experiencing homelessness, those requiring support with alcohol and other drug use, and those who need trans affirming care. It includes the need to focus on building on the positive aspects of young people's lives, their sense of community connection, their creativity, and enhancing the support they receive from friends and family. It includes the continuing need for a focus on policies, programs, curriculum, visibility, and affirmation to support inclusion in educational settings. And finally, we need writing themselves in to run again in less than the 10 years since the last survey was run. And we need research with a range of methodologies, including qualitative research and research that focuses in on the experiences of particular parts of our LGBTIQ communities, including the experiences of young people with an intersex variation. So I'd like to end by thanking the many LGBTIQA plus young people who participated in this survey. We really look forward to working with you together into the future to make this research count.
Thank you so much, Marina. It's my pleasure to now welcome Associate Professor Jen Power, also from ARCSHS, who is both an author on the study and a specialist in sexuality and sexual health. Jen is joined by an incredible panel of LGBTQA plus young people, as well as leaders from within the sector from across Australia, and they'll be sharing their thoughts about the data and what it means for the road ahead. Over to you, Jen.
Thanks, Jackson. I would also like to begin by acknowledging the traditional owners of the lands on which we're meeting today and pay my respects to elders past and present. I extend that respect to Aboriginal and Torres Strait Islander peoples who are joining us here today. I imagine that there are people who are tuning in from all across the country, but I would like to particularly acknowledge the traditional owners of the lands from which our panelists are joining us today. Please jump in if I've missed anyone, but I believe that people on our panel are joining us from lands owned by the Gadigal people of the Eora Nations, the Ngunnawal people, the Kaurna people, and the Wiradjuri people of the Kulin Nations. So I would like to acknowledge that sovereignty was never ceded. Does that cover everybody's locations here today?
I'm also on Guringai country.
Thank you, Rory. And Jazz, were you jumping in there? Well, we can't hear you. Are you still muted? I might just keep going. Jazz, do you want to see if we can work out your sound? Maybe trying a different
Is this any better?
Oh, that's perfect. That's
Yes.
great. Thank
Sorry,
you,
guys.
Jasmine.
I think it's better with headphones. I just wanted to add that while the Greater Sydney area is definitely the Gadigal people, the place where I'm going to be tuning in from today is out west in Blacktown. So this is the traditional custodians of the land is the Darug people. So the Darug Nation covers this entire Western Sydney region here. So
Awesome. Thank you for that. Thanks, Jess. So I'd like to welcome all our panelists to today's launch of the Writing Themselves In For report. As we've already heard today from both Adam and from Marina, Writing Themselves In is a really important project. It's important in Australian history, in large part because it's had such a massive impact on policy and service delivery for LGBTQA plus young people in Australia. But beyond this, I think the project's been really important for young people. So the objective of Writing Themselves In was always visibility. It was always to create a document that young people could read, in which they could see themselves and in which they could read about the experiences of other LGBTQA plus young people and perhaps feel connected, perhaps realize that their stories and their experiences were not more common than they knew, and to perhaps feel less isolated. So I guess from the outset, with visibility in mind, and with the title Writing Themselves In, the project's always been about creating an opportunity for young people to write their stories into history, to write their stories into policy making. And as such, the study's been designed to privilege the voices of young people as much as possible within a study that is predominantly a kind of survey design. And it's done that through open-ended questions and through talking to as many young people and involving many young people in the project as possible. We're really keen within this project to create forums for young people to continue to take up the report, to work with service providers, to work with policymakers, and to work with other young people to actually advance forward, I guess, from these findings, to do something, to take action, or the term we've been using is kind of put out that passionate call for action across the community, across multiple communities, to make sure that the findings from this study that in some respects are really shocking and really saddening, but also really optimistic in terms of where young people are at in their willingness to make a difference, to stand up, to talk to people, to do things. And so that's really the spirit of this panel today. We've brought together this amazing team, who I will introduce in a second, of young people, all of whom I believe are working in education in the service sector, but who have also been working as activists and connecting with other young people, as well as some leaders in the human services sector in Australia, really to talk about where do we go from here. So to introduce our great panel, firstly, I'd like to introduce Rory Blundell. So Rory is a queer and non-binary advocate who's worked extensively within the LGBTIQA plus sector over the years to highlight the voices, experiences and challenges faced by young people. Throughout their career, Rory has worked for a wide range of organisations and programs, including family planning in New South Wales, the Safe Schools Coalition of Australia, Drummond Street Services and the Zoe Bell Gender Collective. Rory is passionate about community-led change, grounded in self-determination, equity and respect. So thank you, Rory, for being here. Oliver,
thank you.
Oliver is from South Australia and currently working for Shine South Australia, who's been quite involved in this project. So Ollie's working in the Shine SA in the school education and support team, and also in the gender wellbeing services team. Ollie has a background in primary school teaching and has also worked in youth mental health education and peer work roles. Ollie has lived experience of being gender diverse and uses this alongside his qualifications to educate teachers and young people about the complexities of gender identity and how they can be better allies for trans people. Oliver is a bit of a data nerd, so I was very excited to incorporate Writing Themselves In the data into his work with school communities and to help create LGBTIQA plus inclusive learning spaces. So next we have Jasmine. So Jasmine Lagaya Phillips is a young activist who lives and works in Blacktown, which I believe is in the western suburbs of Sydney. Jazz is a neurodivergent lesbian and a family violence survivor who comes from a Filipino Australian cultural background. Her activism includes all aspects of social justice with a focus on youth justice, educational equity, racism, LGBTQA+ issues, sexual and domestic violence and mental health. Jazz was the conference head for NOWSA 2019, where she independently organised a 5-day conference on intersectional feminism for Australian women. And in 2020, she was a panellist for Western Sydney Community Forum, where she spoke about how youth-led programs can support young people post-COVID-19. Jazz also collaborates with her partner to run All Out Blacktown, which is a youth outreach program that they co-founded to support LGBTQA+ young people in Western Sydney. And I would like to introduce now Deb Sabaris. Did I say that correctly, Deb? I apologise if I didn't. I meant to check with you.
Perfect.
Sabaris, thank you. Thanks, Deb. So Deb is the CEO of the Centre for Excellence in Child and Family Welfare, Victoria's peak body for child and family services. Deb has over 32 years experience in the not-for-profit and public sectors, having worked extensively in health and community services and held executive positions in organisations working across youth services, disability, drug and alcohol support services and employment programs. Deb provides policy leadership to state and federal governments and is a strong contributor to the child and family services sector. Throughout her career, Deb's been instrumental in working collaboratively across departments, governments and community sectors to address long-term strategic needs and community objectives. Thank you, Deb, for being here. Sorry, these look shorter on my page, but they're long introductions, but it's actually really nice to hear about you all. So I'll move on to Tim. Tim Bavington is joining us from the ACT. Tim has spent his working life as a youth worker, community educator, secondary school teacher, and organisation leader in the non-profit sector. Tim is currently Chief Executive at Sexual Health and Family Planning ACT and was on the advisory board for this project. Prior to working at ShaftPack, Tim established the Service Assisting Male Survivors of Sexual Assault in the ACT, which came under the auspice of the Canberra Rape Crisis Centre. Tim's professional life has focused on youth health and wellbeing, prevention of and community responses to sexual violence, and the role of education for personal and community empowerment. Tim's personal interests include history, languages, and I believe you're learning Irish languages at the moment. Excellent. And Tim is also a foodie and coffee enthusiast living in Canberra with partner and children. So very big welcome to all our panellists today, and I look forward to hearing more from you. The way this is going to work is really I'm going to ask questions of individual panellists. And if we've got time for other panellists to jump in and respond to that question, let me know and we'll see how we go with time. So I'd like to start with Rory, actually, if that's okay.
Yep, all good.
So Rory, as Adam's really just outlined, the report for writing themselves in for reveals some really quite shocking and in some ways saddening statistics on poor mental health and on suicidality among LGBTQA+ young people. Some people, I think, in the broader community might be surprised by this, given so much public focus is these days on things like Mardi Gras, on marriage equality, and on the positive changes we've seen in recent years. So I just wanted to ask you whether or not you were surprised by these statistics.
I think with these statistics, I mean, they are really distressing. And even as a community member, I think, even though this is reflective of my lived experience, my friends' lived experience in the communities I'm a part of and work in, they're still really distressing, but they're not surprising. And I think this is really actually quite reflective and validating of the experiences we have, both of like the discrimination that we face, but also of the lack of appropriate services and accessible services too. And I think in some spaces, like in some inner cities, like we've seen a fair bit of change and acceptance and support services, but in other spaces, those still don't exist, or they're still extremely hard to access. And I think we've also had acceptance with conditions. We've had things like safe schools come and be taken away. We look at the effects of marriage equality. We look at, again, who's represented, who actually has power within our communities. And I just see the enormous lengths that LGBTI young people, particularly trans young people and trans feminine young people, have to go to just to feel safe, just to feel like seen in their identity, to access healthcare, gender affirmation, just to go to a pool or to find a toilet, to find a sports team. And I think some of those conditions for acceptance are impossible for us to meet, and we shouldn't have to. I think the other part of this research that's also not surprising is our resilience and creativity that is so apparent throughout this whole report. And I think we are resilient and we are amazing as a community, but hopefully like this data will shift some of that work and responsibility that we've done and actually delegate that to the broader community as well.
Yeah, thanks, Rory. And I think that's really important to remember. The resilience and the creativity and the optimism is certainly there. The joy is there. But as you say, I think it's the everyday. It's the everyday discriminations and pressures and ignorance that kind of shows, I think, in these data. And with that in mind, actually, I have a question for Oliver. Ollie, I keep calling you Oliver Ollie. I hope that's okay.
Ollie's fine. Yeah.
As someone who's worked in education, what for you were the most striking findings in the report with respect to schools and educational settings?
Yeah, I think that's a really good question. And I think my answer essentially touches on what Rory has said, is that some of these statistics are really distressing, but from someone who's kind of paired this education background with lived experience, they're not necessarily super surprising. But I think the most striking thing that I found when reading the data, and I've been sitting with it for about maybe a week now, is it's all these little statistics and these little points of data that we can take from young people. And we can kind of understand the daily emotional labour that these young kids are going through. I think the ways in which we maybe used to understand mental distress for young LGBTQ people might have been, maybe an instance of violence or harassment, and then after that, they're all good. And, we've got marriage equality and we're done and dusted. But actually, there's a lot of everyday microaggressions, everyday factors, everyday stresses that young people are going through when they're part of the LGBT community that are just exhausting. I think that's where those poor mental health outcomes come from. So I'd say that would be the most striking thing, is that we've got these young people who are in school settings who are not even going to think about their maths homework or their novel they've got to read, because they're busy, being worried about where they're going to go to the bathroom in 20 minutes or something like that. So I think for schools, the schools are a little community, and we need those little communities to help with that emotional labour and help alleviate some of that, for sure.
Yeah, and I like how you put that, those sort of everyday stresses being cumulative, but also there's real power in those small communities, in those, thinking of school as a community, I think is a really nice way of doing it. There's been really limited change over the past 10 years in some of these statistics. We can see, looking back since 1998, which is quite a long time ago now, actually what people are reporting on in schools is pretty similar. You started to cover this, but is there any more you can say about what you think needs to happen within schools to make sure we don't see the same statistics again in another 10 or 20 years?
Yeah, I think it's tricky because, a lot of these things are competing with generations of harassment and generations of legal and social discrimination. So undoing that, even in one generation, is a huge feat that I think we're doing quite well at. I think we've got a long ways to go. But I think schools in general, like you said, they are small communities, and those communities are definitely inclusive of the teachers and the educators, who thankfully are now accessing more training around how to be inclusive with their language and learning how to create spaces that are inclusive for their young people. But school communities are also influenced by the structural changes that lay over them, like government policies and curriculum, but they also sit next to the communities that they serve, so the parents of those kids and the surrounding suburbs and everything. So it is really interesting, and I think all these things are so closely connected, and having homophobia and transphobia addressed in one section is fantastic, but it has to be addressed in lots of different ways for that kind of overall culture to shift. I think we're getting there, which is good.
Yeah, I agree. The fact that we're even asking questions now is one difference.
Yes.
Ago, that's a start. And actually that moves nicely into, Jasmine, I had a question for you actually about local community, and I like how you've sort of put schools, Ollie, in those sort of multiple different communities and different influences. Jazz, you do a lot of work in your local community, so a lot of work supporting young people as an activist, as a community worker, as a teacher, and as an advocate for youth services in particularly in the western suburbs in Sydney where you live. What do you think we need to do to strengthen community responses for LGBTQA plus young people in local areas?
Yeah, absolutely. I think to start out with, just something that when we're talking about schools being, sorry, just what Ollie had said about schools being local communities, but also being situated within their local communities really resonated with me. I'm not going to mention where I work or where I'm teaching, but I do feel like I'm not able to be out at work necessarily. So that's kind of a good indicator of the community that I live and work in. And it's a good indicator that I'm very confident and very happy with being out in my life. And I'm an advocate and an activist in so much of my life. And I'm not comfortable being out in my local community necessarily, especially in my professional role. And it was difficult to make the decision that I definitely wanted to be here today, knowing that somebody could be watching from my local community and aware of that. So just kind of keeping that in mind. One thing that I just like to kind of, with particular local communities, something that Adam had mentioned earlier was that just because things have changed a lot in the cities and in in certain areas and certain suburbs, doesn't mean that it's changed for everywhere. And I am very, very passionate about my local community, and we do a lot of volunteering in our local community that is aside from our LGBTQ stuff as well. But with our local community, we know that growing up in Western Sydney is one of the most difficult places to grow up in Australia as a queer young person. We know that because we saw our data in the 2017 marriage equality postal survey. We saw that 12 out of 17 of our no voting electorates sat in Western Sydney. And if you have a look at the map of all of the no voting electorates, the voting electorates that have the largest proportion of no voters, that have the largest proportion of people who believe that we were not entitled to those rights, it exists directly in a circle around where I live. So a lot of the young people that we're seeing at our local youth centre are living in a community where people genuinely either feel like they've never met a person who is part of the queer community before, or they actively have really negative, potentially traditional ideas and views about queer people. So we're living in a community, again, where there's a lot of microaggressions that are happening, but then there's also a lot of physical street harassment and verbal street harassment that's still happening with our young people in our local community. My partner did a survey just for an assignment of hers at university, where she found over 80% of young people in our area had been either verbally or physically abused in our local area because of their identity. So these statistics are matching up because we know that a lot of the statistics of people who are experiencing this are coming from our local areas. So we're seeing these pockets in massive areas like Blacktown LGA is one of the fastest growing local government areas in the state, let alone the country. But we know that there's this huge gap here, and we know that these services are working from a deficit. We need to know that these gaps exist. We need to know it's not just about working in the middle of the city, working in the capitals. It needs to also involve our community organisations, our grassroots organisations. We need to be prepared to come out further than we've been coming. And there's been plenty of people who are trying to push a little bit at a time, but unfortunately it's not always enough. So we know that our young people out here need stuff. They need help now, they need support now. And the services that are available to them a lot of the time are not queer friendly, or they're just not experienced at working with queer people because there's this huge deficit here and there's that lack of visibility here. So I definitely think that just understanding not just communities like Western Sydney, but all communities, and understanding that it doesn't start and end with the metropolitan city areas that we're basing these things in. The organisations that we rely on, like ACON, need to be prepared to come out west, or to come out wherever the people need people to be coming out, so that they can start that process of education, so that they can work with the community to establish a better understanding of queer people and what that means.
Yeah, thank you. That actually, again, leads really nicely into, I've got a little set of questions I wanted to ask Deb and Tim, which sort of relate to what you're saying in terms of how we can resource and organise and call the service sector to action, I guess, and what we need to think about what's working, what's not working. So Deb, I might start with you if that's okay.
Sure.
Certainly Adam's presentation showed us that the report findings have a sense of urgency. There's some really concerning statistics within that. So with that in mind, what would be your invitation to people in positions of power or people making decisions about funding? What is your invitation to act? What would you encourage them to do, or what is the call for action?
Some of this is complex, but some of this is really simple. First of all, I'd like to also acknowledge land. I'm on Wurundjeri land of the Kulin Nation. I just want to say thank you for Adam for asking me to be on this panel. And that I feel very privileged to be with this amazing group of people. I must say that and I know there's about 600 people sitting on this webinar today. These are shocking statistics that I'm sort of amazed that there isn't sort of some more of a public outcry, because the data is horrible. Even though some of the first few slides of Adam's presentation was positive, it's hard to remember that now when you get partway through the presentation. So the statistics are really alarming, and people like me and others need to be alarmed and actually need to speak about it, need to speak about the research. I mean, it's actually unusual because I probably wouldn't be invited onto this panel, even though I'm a lesbian. I probably wouldn't be invited on it because I run a mainstream organisation. And to the ingenuity of Adam and the researchers to invite me on is sort of the beginning of something. But, you know, what I would say is that certainly here in Victoria, the pitiful amount of resources that are dedicated to specialist services for young people in the queer community is outrageous.
And Victoria is probably one of the best.
Well, it is outrageous. It is, it makes me angry. And the net result of that are the statistics that we see in this report. There is a complete and utter relationship between the two. Now, mainstream organisations are fantastic. I run one, I run many, and we are very well resourced, and I am a very good advocate. We got $1 billion in the state budget in November. You know, there's a set of problems here for this group of young people: homelessness, DNA, mental health. And there needs to be dedicated specialist resources for these young people to be able to access safely, as Rory said. But, you know, this is not okay that it has to be the begging involved mentality or trying to access services where young people don't feel safe and therefore don't. The desperation has got to stop. So for me, it's about using that language and running a range of campaigns that get some results, because this is unsustainable and it's sad. And the opportunity costs are enormous. I mean, there is both a sort of a dreadful social and economic impact to these young people that they bear. And I don't think policymakers or government have made sensible decisions in this space. I could go on and on, Jen. So let me up.
There's so many follow-up questions. I might just jump to the other question I had for you, because I think it relates. I mean, it was really about, if you were going to give advice to advocates who are here today, you know, people who are working as researchers or as youth advocates or in the community services sector in some way, like, what do we need to do? What do we need to be calling for, really, to ensure that there's adequate resourcing for LGBTQA young people? Do we need a different model of funding? Is there adequate resources? Do we need more money? Like, what's the call?
Well, the call is basically, frankly, it isn't about, to be honest, and with all due respect, it isn't necessarily about more rainbow tech, more accreditation. It's actually because mainstream services are jumping to do that. They want to do that. They want to get rainbow tech. They want to be accredited. They want to be supportive. But some of these services cannot be delivered by them. They're unable to deliver them. They don't have the connection to the community and expertise. They must be community-led. They must be specialist by nature. They must be able to reflect back to young people what they need. And young people need to be running these types of services. So for me, it really is quite simple. And whether it's a specialist drug and alcohol response, a specialist mental health response, and specialist homelessness services, we can't go on with something in the range of, I don't know, $500,000 being targeted to specialist services to the LGBTQI community in Victoria. It's sort of humorous if it wasn't so sad. So for me, I think that today everybody on this call needs to know that that's happening in their own submissions to government. The state budget is in May. They occur at all different times around the country. Make sure that in every single one of your submissions that you include something that is a quantum of funding for the community to run their own services. And let's not get caught up in this mainstream versus specialist, because actually there isn't a choice. This research clearly indicates there's not enough investment in queer young people, and there are not enough dedicated services. So call it out in your submissions, and every time you get to talk to an MP, tell them about it.
Thank you, Deb. That was great. I feel like recording that and writing that down. I also noticed Jasmine as a young person who set up a dedicated youth group for LGBTQA young people. Like, imagine if you'd had access to a pool of funding you could apply for.
We can't even, oh gosh, we can barely, the youth centre that we're at is completely underfunded, like completely unfunded. We can barely run the essential services program there, let alone the service program that we run that's meant to be for LGBTQ people. So if we can barely even support young people with the funding that we're being given at all, how are we supposed to get that across to support the people that we want to be supporting in our community?
Can I just say one more thing, Jen? Just one more thing. The solutions are in the hands of the young people we're talking about today, and the young people. And we don't have. Look, I don't have the answers. I'm old. I'm 57. I've got 4 kids. I don't have the solutions that you have, and so government need to listen to young people and listen to the solutions that they say will assist them to address some of the things that came out in that research. And I actually do think times have changed since COVID. I think government are listening to different, Jasmine, it might be different where you are. It might be different there. But I do think that the solutions are in your hands, and being persuasive about what those are, and that they will, we know they'll work. But let's have another conversation, Jasmine, about how I can.
No, that's okay. It's all good. It's all good. No, I completely, it's tough because I do completely agree as well. It is so much, it is in the hands of the young people. And then it is, for me, my reality is knowing that the youth centre that we're at has the young people, it has the bodies, it has the bums on seats, and not the support from the local government or the state government, the funding, all of those things. We know that this, like, it's a phenomenal youth-led centre where literally the first time that Britt and I reached out and said, are you running any LGBTQ programs? They said, we think you should run them. We think you should run one because you are community leaders. And this centre has been completely unfunded for 2 years. So we're talking about, you know, staff who are having to take personal pay cuts to keep the lights on. And we know that this is a youth centre that's doing incredible work in our local area. But the local response is, if it shuts down, too bad, so sad, there are another 30 youth centres in the local area.
And can I just point out who's doing that work? You know, it's still LGBTI young people who are doing all of that work and carrying all of that risk.
And like at the end of the day, like I work full time, my partner works more than full time. We're both trying to juggle everything because we know how important this is. We don't get paid for the work that we do. A lot of it comes out of our pockets, but we know it's important. And we need people who are at a higher level to understand the need that we have, because every young person that we've ever had come through that program has told us, I can't believe this is run out here. I never thought that I would get anything close to this service, anything close to this support in my local community.
Yeah, thank you. I wanted to actually, Tim, that leads nicely into the questions I have for you, which are really about political support, I guess. And what do you think really needs to happen now to push forward some of the recommendations from the Writing Themselves In report? And I was going to say at the state and territorial as well as national level. So I'm interested in your perspective on the national level. I might also throw in their local level if you have thoughts on that, because it's like that's part of this picture that perhaps we speak less about, perhaps local government. But not to, you know, throw in a curly one. That's state, federal, local. What do we need to push for with government?
Look, I'll probably be reiterating some things that the others on the panel have said so beautifully. I think we need those at the coalface, those who are working in community, I think are not surprised, as Rory said right at the start, about some of the data we've seen. But I think if there's anyone out there listening today and who's going to read this report who thinks that, you know, we've kind of moved on from this area of need, then I think these data tell us that that's not the case. There's still a lot to do. So the first thing I think we should all do is go out and talk to 5 other people and ask them to talk to 5 other people. Do the respect to the work, to the research team that's gone into this piece of work, and to all of the other people who've supported it and the young people who participated in it, to read the report and read it not just to find interesting stats, but to read it for insight and understanding about the experience that it describes, to read it as a whole and then read it again, and then go and look at the small parts, the stories that it tells about complexity and diversity. And then I think for me, the next steps really clearly are, this is going to have to be shared effort. This isn't actually about there is one place or person or area that can do this. This is government and communities moving forward with what we do next. This is specialist LGBTIQA plus services and mainstream health and education services making sense of this and asking ourselves hard questions around, have we got the mix right? And if you work with young people, you need to read this report. If you work in mental health, you need to read this report. If you work in queer community, you need to read this report. Everyone needs to read this report because it talks about our whole community, not just, you know, a marginalised subset, but there's something in there that's about everybody. And we need to keep doing that work to build safe places for young people to connect and to make all of our public shared spaces safer for them to be in. So it's not one thing for me. It's about, without the input, the best efforts, the expertise, the engagement across whole systems, whole communities, we can't engage with the complexity that this report sets out. I think the beauty of our system in Australia at the government level is that the federation and the local government overlay of that means that we get to experiment a lot. We get to try different things. Government should theoretically be being really responsive to its local community needs. And not just applying one-size-fits-all settings that you might get in other kind of systems. But the great challenge of that as well is that issues and needs that are true everywhere get responded to differently, you know, and I think this is the challenge of our government system. I know that here in the ACT, government is eagerly anticipating this report in order to help have some of these conversations and talk about what next and what's important. And I imagine that that's the same across the country, especially at the state territory level, where lots of the responsibility for the service systems that operate at this level are held. Indirectly, though, the Australian government, our national government, resources, spends millions and billions of dollars supporting these sectors and systems that we've been talking about today. But I think at the moment, it feels like there's a really big absence of policy interest in looking at these areas of health and wellbeing and social and community participation. And we do need a national aspect and national perspectives to address the story that's the same across the country that the report reveals as well. There are some things that are universal about the Australian experience, and they need a response at that level, just as much as there's a story about local communities that need a response at that level.
Yeah. And Tim, do you think that, I mean, you sort of touched on this, I think, but do you think that there is willingness to address these issues and support nationally or at a state level?
I do. I think the optimistic and the positive story is, of course, and we've seen it over the last decade in communities leading around where our political leadership waned, community-led, you know, the debate about the need to bring and legislate marriage equality. It's just as an example of that kind of thing. So I think the Australian community overall absolutely wants to be inclusive and positive, is positive about diversity, accepts difference. But in that community are still people who struggle with the combined sense of of change and the newness of some of the expressions of diversity in sexuality and gender and sex that, you know, we feel in this area we've been talking about for decades. But for some people, it's new and it's completely world, you know, mind-altering kinds of concepts for them. Now, they need some time to manage their own response and experience for that. We can't wait for everybody to be comfortable before we take the next steps. That's what this report tells us, is we have to move, because in the areas of most dire need, we can't wait till everybody in this country feels like they've got their head around gender diversity.
Yeah.
The need is too great.
Yeah.
But we do need to respect that people are at different points and that they need spaces where they can connect while other work really does move along and advance in the kind of way that you know, the young people on the panel have talked about today. You know, as suggested, that needs to be driven by young people themselves as well. We can't wait for the whole system to be ready before we start doing some of that work. Overall, I think as a community, we're willing. I expect there'll be both support and opposition voiced around this report and about the implications that it has for practice. And I think you wouldn't expect less in a democracy, but I think it tells us that we have to move differently and with more urgency than I think the sense that maybe this area has been well covered, because this says, yeah, we've got some good things to point to as positives and things to build on. And as Rory said at the start, resilience. You know, it tells a story of great resilience. So we've got good building blocks to build from, and there's heaps more still to do. And I'm looking forward to the role that we all play in doing that.
Thanks, Tim. Look, we've just got about 6 more minutes left on this panel, and I've got 2 questions. So Jasmine, I'm going to throw a curly one at you and give you about a minute to respond. I'm really sorry, but you know, it's just to sort of flag that there was really diverse responses, a really diverse community of young people who responded to writing themselves in, both in terms of sexual and gender diversity, but also real diversity in where people lived, cultural diversity, ethnic diversity, diversity in terms of disability. How do we approach this? You know, how do we ensure that there's inclusivity in our response? I think really
sorry, I know it's a quick response for this one, so it's all good. I think that the most important part of making sure that you are respecting that diversity is to make sure that you are asking people who belong in those minority groups. So the worst possible thing that you can do, like everybody wants to have a go and everybody wants to be inclusive. The worst thing you can do is create a panel of, you know, like 5 people who have the exact same experiences. If you're working at a policy level, if you're working at any level at all, and you're making a decision that affects young people, make sure that you're speaking to somebody who has the same identity group. Make sure that you're representing people who have the same identity group. It's vital that people are able to see themselves in all of these elements of this, in all throughout community support. As much as, you know, it's a tricky thing for me to try and be out in the workplace, at the same time, I know that when I go out for a walk with my partner in my local community, if I happen to get seen by a person who was a young queer person, that puts them in a good mood, because it's something that is really massive that we haven't had. Those little things, visibility is important. Understanding and getting it from the mouth of the people that you're making decisions about is vital. You cannot make decisions about a group without consulting them, and making sure that you aren't thinking about diversity as an afterthought. Don't think about diversity as something that you're doing because, oh, you know, later on we'll realize that we had to do this or things like that. You know, when we were developing our youth group for the first time, we kind of had just thought that, you know, we've got to make sure that we don't know who turns up, so we've got to make sure that we're as inclusive as possible. And the people that came to the youth group wouldn't have been people that we necessarily had thought would come and visit us. There was a huge number of trans and gender diverse people that we hadn't known existed in our local community. There were so many different people from different cultural backgrounds that we work with. So you need to cast the net out, but then ask about how to best include them, because they know best.
Thank you. That's actually an incredibly simple and obvious answer to what I thought was complex. Of course, will you ensure there's diversity and representation? It's actually very, very simple when you put it that way. Thank you. So I've got one final question, which I was going to direct towards Rory, but Oliver, I might ask you to jump in too if you've got more to say. That would be great. And really, maybe it's in this sort of same category as a question that's both complicated and complex, but also incredibly simple. So Rory, what do you think we need to do to ensure that we support LGBTQA young people to take a lead and be empowered in the response to this? So we've heard a lot about the need for young people to take a lead. How do we resource that and support young people?
I mean, I think the first thing is so simple, and that's just to listen to young people. And thankfully we have this whole report, but specifically like chapter 14, I think as well, where we provide those solutions. But I think when you listen to LGBTQA young people, the most important thing they talk about is just feeling validated, accepted, and seen for who they are, and to have the space to actually explore and affirm their identity. And that is as simple as using the language that they want you to use, using names and pronouns. We also need our allies and those of us in power to actually challenge those attitudes and those ideas and those things that diminish and harm us. You know, we need our allies to take on that risk because we bear the brunt of that. And sometimes that's going to mean about having those kind of challenging conversations, because, you know, we need facilitated connection to our community. We need to have our mentors and role models. We need to see ourselves in our workplaces. We need to see ourselves everywhere. We need to see ourselves in our support services and our resources, and especially in our community. We shouldn't have to pick between parts of ourselves. We're whole people. We shouldn't have to pick between family and safety. We shouldn't pick between having to live within the community we grew up in and actually having support. We shouldn't have to move off country to find acceptance. We shouldn't have our gender affirmation pathways this controlled and this denied. We need to feel like we're valued by our communities, and it's exactly what Jazz and Oliver were saying before. And we need to value LGBTIQA plus young people. We especially need to value our trans and gender diverse young people, our sister girls, our brother boys, our First Nations queer folk, our queer people of colour, people living with disability, people with intersex variations, people living beyond the binary, and people, especially those young people whose identities and experiences may challenge us. I actually think these are the things we need to focus on. And value looks like funding, it looks like supporting, it looks like believing, and it looks like advocating. Like, we know how much value there is in diversity as communities, we really do. It's really now time for other people to start not just accepting and tolerating, but actually looking as to what they can learn from us and to look at the pathways we've already done.
Thanks, Rory. That was really great. Actually, that was a lovely summary. Ollie, is there anything?
That was a lovely summary. I guess when hearing Rory talk, I think I was reflecting on what that means from a school, like, you know, what it means for young people in experiences in schools. And I was thinking about how a lot of what Rory said applies obviously to school communities, but I think schools in particular need to model LGBTQ people who are in authority positions, who are in powerful positions, who are being the heroes of their own story, who are having all these amazing experiences. Because I think some young people, you know, the only media they're exposed to in a school environment is the books that the library purchased 20 years ago. And it's like, if they can't resonate themselves in those stories, well, how are they going to think they can be the hero of their own little community? And I think also, you know, those things, those challenges we mentioned around feeling safe in school, they will directly relate to whether young people are able to step up and be community advocates. Because it's a little bit like how on an airplane you have to put your own face mask on first before you help someone else. If our young people are thinking about, like, they can't even wear the uniform they want, they're not going to imagine themselves as being community advocates or doing amazing, you know, confident things and standing up in front of the community and rallying. They're just thinking about how to get through that day.
Yeah.
I think the only way we're going to get community people who are able to advocate for themselves in their communities is to make sure that they know it's safe to do so and that they've seen people who can do it safely. So I think, you know, it's all intertwined and stuff. So yeah, I think there's a long way to go, but I think we're definitely at a turning point now, for sure.
Yeah, for sure. I agree. I think we are at a turning point. And I think just the 6,000 plus people that responded to this study are kind of testament in a way to that turning point. There's a lot of young people out there, you know, kind of.
And I was thinking as well, I've been thinking about, like, while the panel has been discussing, I was thinking about what would happen if a study of a similar size revealed that, you know, 1 in 4 young people had been in a harmful car accident or something.
Right.
You would see national advocacy, you'd see bus stop signs, you'd see it on every news channel. But we're hearing the same thing from young people who are suiciding or attempting suicide, and it's still kind of less spoken about than what we'd hope. So I think it's a good start.
It's a good start. Yeah, but you're right. I mean, this gives us what this needs to be is a platform for drawing attention and for actually crying urgency in that sense, that this is an urgent issue and there's people willing to move it forward to help. So that actually brings us to the end of the panel. I'd really like to thank all our panelists today. It's been fantastic. Every time each of you was talking, I had, 5 or 6 different questions in my head as follow-up. So we could have been here for hours. And I hope that we get another chance to speak further about some of these issues. So thank you, Rory, Jazz, Oliver, Tim and Deb. It's been really lovely to meet you all and great to chat. And thanks for being part of this launch. Thank you.
Thank you so much, Jen, and a huge thank you to Rory, Jazz, Oliver, Deb and Tim for joining us today. There's so much to process and reflect upon of what was just shared, and I'm so glad we're recording it so that we can do that. That idea of a cry of urgency and a turning point and that call to action. And I love what Tim said about everyone here today, finding 5 people who they can talk to about this and asking them to talk to 5 people. Perhaps it's something to begin a conversation, to reignite that conversation and to galvanise and reorganise is what we need right now. As part of the final part of proceedings today, we'd like to share with you a very special video. We shared the results of our research with our fantastic Youth Advisory Committee and asked them what they thought. And this is what they had to say. If we can roll the tape, please.
Over 6,000 LGBTQA+ young people from all over Australia have shared with us their experiences of everyday life. They told us about their health, their time at school, TAFE and uni, and about their relationships with family and community. We shared what the young people in the study told us with our Youth Advisory Committee, and this is what they had to say.
When you're a member of the community, you are constantly connected and talking to people who are going through these things. It's hard to look at any of the data without just putting a name to it and putting a face to it.
It's not surprising because it's something that you live through every day and other people, part of the community, will live through every day.
Something really does need to change. The discrimination and harassment on one end, that needs to stop and needs to change, and people's attitudes.
It's so easy to overlook so many tiny things that are these constant cultural barriers to feeling safe and protected.
The services need to change. So when people are in crisis, they actually have somewhere to land. Gendering people correctly, using the correct name and pronouns, gender affirmation pathways, connecting to community, connecting to role models, connecting to friends, having support groups that are LGBTIQA+. We need to start looking at these things as suicide prevention. LGBTIQA+ people are super diverse. The needs of trans and gender diverse people, for instance, will look different to cisgender queer people. That if you're working or living in a remote or regional community, that those experiences are going to look different to people who live in inner cities. It's just really important to remember that this is not the experience of every single LGBTI young person, and that actually the things that can be really helpful in preventing these kinds of things in around mental health and suicidal ideation are things like supportive family and friends and supportive community, and that we each have a role to play in that. If we have we challenge discrimination, we challenge harassment, and actually provide those spaces of safety, that these statistics don't have to be this bad. All queer young people deserve to feel loved, supported, and absolutely celebrated for being who they are.
Oh, no matter how many times I see that, I get a bit emotional each time. It feels a bit emotional as we come towards the end today. I'm sure I'm not the only one feeling that way in this moment. Thank you once again to our youth advisory for all your incredible and valuable guidance and support. I'd also like to thank a member of our team, Ivy, for all your close work with that group to ensure that our work is guided and is centering the experiences of the youth, the young people who's, as we've heard and as we've seen demonstrated, are the experts in their own experience. We've learned a lot today about the lives of LGBTQIA+ young people in Australia, and a lot about what we call, the essential actions required to make a real difference. As Marina said, we need meaningful, broad and sustained action to address the drivers of these experiences and change the outcomes for young people and to prevent harm before it occurs. Each of us here today have a role to play in making this happen. As we come to the close of today's launch, on behalf of ARCSHS and the Writing Themselves team, I'd like to thank all of you for coming. And above all, we'd like to thank all the young people who participated in the study. It is so important that we continue to listen and center young people in designing the strategies that will arise from this work moving forward. Please be sure to download and read the national report if you haven't already and share it with your networks. Some of the information presented here today has been challenging and may be distressing for some. If so, we encourage you to call one of the numbers on the screen now and have a chat to someone about what you may need moving forward. Take care, everyone. Have a great day. We look forward to working together for a brighter future.